Hi, I'm Dr. Garo Emerzian. I'm a podiatric surgeon with Illinois Bone and Joint Institute, board certified by the American Board of Foot and Ankle Surgery, forefoot division, reconstructive rear foot and ankle division. So the way I'm going to do this is I'm going to start with the distal part of the foot, simple problems, and work my way back all the way to the ankle. So with that being said, first thing is some people will get blood underneath their nail, subungual hematomas from running. The toe box and toes are jamming into the toe box of the shoe, and they can get blood underneath the nail. It's called a subungual hematoma. Will cause pain. One thing that can be done for that is just boring a little hole in the nail to let some of that pressure out, let some of the blood out. If it's symptomatic enough, then you can come in and be taken care of. Sometimes you have to remove the nail for that. Another problem in the foot and ankle with respect to the forefoot is capsulitis. Usually occurs in the ball of the foot. Will feel like somebody's walking on a marble. Toe runners usually can develop that with increased mileage. It's more of a chronic condition. Sometimes can be an acute condition. The way that's treated is more offloading, taking the pressure off the ball of the foot to let that kind of quiet down. The best analogy for that would be a bone bruise. And on your foot, trying to offload the foot to take the pressure off is the way that's the way that's accomplished. Other things that can occur in the foot and ankle: stress fractures with increased mileage, a lot of stress on the foot. Sometimes stress fractures can occur in the top of the foot. Fourth metatarsal is the most common. Sometimes swelling can persist for that, and that's kind of the tip off that tells you, hey, something's going on, pay attention. That's something that you probably need to come in to the doctor's office to get an x-ray to see what's going on in that area. Other things that can be symptomatic is Achilles tendonitis, just overuse of the Achilles tendon in the back of the heel. Inflammation is what can cause that. Posterior tibial tendonitis is on the inside of the arch and foot. That can be symptomatic. Again, more of an inflammation and overuse syndrome. A big one is plantar fasciitis, seen in the bottom of the heel. With increased running and stress, that can occur in the bottom of the heel. Dull, achy pain, first thing in the morning, it bothers you first few steps out of bed. That's kind of a tip-off. Same thing with the Achilles tendonitis. First couple steps out of bed, it bothers you, and that's basically in the back of the heel. Treatment for that, you got to rest the part, quiet it down. Anti-inflammatories, icing are modalities to treat that. If it's symptomatic enough, then something you need to see the physician for to take care of that and address it and further remedies for that. So one thing that's often asked is, what's the difference between injured, hurt, and discomfort? A lot of times runners are adept to having soreness and discomfort and sometimes try to run through pain. If the foot or ankle is talking to you, you have to listen to it. If it persists for a few days and it's not getting any better, let's say you take a couple days off and you rest and you start feeling better and then you start doing it again and it aggravates it, that's something that needs to be addressed, and you need to see a physician for that. Perfect example is I saw an older gentleman this week. Last week he was running on Monday, felt soreness in his ankle, stopped running for a few days, started running back on Friday, pain reoccurred. He came in, ended up he had a stress fracture of his ankle, and that was something that needed to be addressed with a walking boot. One thing that's often asked of myself is, what is preventative maintenance? And what can you do to be proactive to help prevent injuries? Number one, very important, stretching. You need to stretch before and after you do your runs. Shoe gear, very important. With respect to shoe gear, what's a good quality shoe? You want something that has a rigid heel counter, rigid sole, good stability of the shoe, so when you're running, it's going to support you. Many people think shoes last forever. If you're wearing a shoe day in and day out, after about 6 months, you should probably change out that shoe. The last of the shoe, the integrity of the shoe usually breaks down. Sometimes orthosis can be important for the foot and to support the foot to offload. For people that have a real flat foot trying to run, very common to get tendonitis, posterior tibial tendonitis, which is in this area. plantar fasciitis or heel spurs, which is in this area, an orthotic will support that and help offload and take care of that problem. So one question is often asked is, when should you see the doctor? Well, if something persists for a few days and resting it and icing it doesn't take care of the problem, that's a time that you probably should seek professional advice and help for that. Couple things, other injuries that can occur, fractures. If you're running and you develop a fracture stepping off a curb and you injure yourself in the fifth metatarsal base, which is in this area, just like that type of injury, that's something that needs to be addressed, and you need immobilization, and you got to shut yourself down for a little bit. Ankle fractures is another thing. You roll your ankle and end up with a fracture. That's something that you need to seek professional help and get x-rays and be treated either with conservative measures, and a cam boot can suffice, or it may be something that needs surgical intervention. Stress fractures, that's more something that needs to be done with resting it. Also, immobilization is the modality to treat that. And again, that's something you need to see a professional for that.